I'm Dr. Christine Kazmar, and I'm on a mission. And my mission is to save 5 million lives from the broken medical model. The medical model is extremely broken. And when I talk about the medical model, by the way, I'm not talking about crisis care, emergency care, gunshot wounds, burn victims. I'm not talking about that. Okay, this is where medicine really excels and exceeds expectation, right? What I'm talking about when I say broken medical model are things like Crohn's, colitis, common colds and flus, diarrhea, constipation, nausea, headaches, heartburn, all of those types of things. These are the areas with which I describe the medical model to be broken. The medical model is broken because they treat everybody the same. It's a one-size-fits-all approach. The medical model is broken because they rely on prescription medications, which will never restore function. Understand that. Prescription medications will never, ever restore function. Just today in practice, I have a patient who had some tissue removed from her breast, and the typical protocol with any of that kind of thing is the radiation and then 5 years of tamoxifen. This is a high alert drug, damages the blood, can create leukemia, and yet they want to put people on this for 5 years. Another example of the medical model being broken, okay? So what I want to do is talk to you today about energy and food explained. And what I mean by that is when we think about food, we don't really connect the dots to what's going on with food and gut to stiff achy joints, headache, heartburn, nausea, constipation, Crohn's, and so forth. But I'm here to tell you they're very much connected. One of the big problems people have is, and you've heard me say this a lot, is people think you are what you eat, right? People say that all the time, you are what you eat, and that's just false. Better said is you are what you digest, okay? You are what you digest. That's the key here. You are what you digest. Just because you eat something healthy for you, in fact, most of my patients who come here and sit in my consult with me, they're eating well. Their diets are great. They're eating plenty of green, leafy vegetables. They're really plant-based, but yet they are having problems with irregular periods or nausea or diarrhea or Crohn's and this kind of thing. So again, it's not that you are what you eat. Better said is you are what you digest. And so food is the real medicine. Food is the real medicine. Prescription medications is not going to restore function, but food, fats, carbs, proteins, vitamins, minerals, and enzymes, that's what's going to help restore function. And why that is because that's what the body wants. So I'm going to do a little whiteboard action here. Hold your questions to the end. I'll come back and answer your questions at the end. And then also want you guys, if you're interested in this video, check out my podcast. And you can find my podcast on iTunes. It's called Smart Digestion Radio. If you want to learn more about my products, I have 3 products in my digestive line. I have a digestive enzyme, I have a probiotic, and I have a healing enzyme. And they all are in the Smart line, meaning Smart Carbs, Smart Lymph, and Smart Probiotic, and you can get there by going to omegadigestion.com. Okay, so we got energy and food explained. And what I have here, CPF, you probably know what these are, but let's kind of get to this first. So what is food exactly? Because this is the real medicine. Food is the real deal, okay? That's the real deal. RX, not the real deal. This will never restore function, ever. And this causes more sickness and disease, okay? You can't keep treating symptoms and expect good results. That's insanity. Food is what really the answer is. And so when we look at food, we have fats, carbs, proteins. So foods are 6 things: fats, carbs, proteins, vitamins, minerals, and enzymes. This is what foods are, these 6 things, okay? Now, let's go back to my board. When it comes to energy, your body is going to utilize food in this exact sequence. So the C stands for carbohydrates. Okay, these are things like your fruits. These are things like your sweets. Okay, these are things like beans, some dairy. Those are the primary sources of carbohydrates. The P stands for proteins. I'm going to go over all this more later. So this is going to be things like eggs, nuts, fish, meats, some dairy. Okay? And then finally we have fats. Okay, and so this is going to also be things like eggs, nuts, oils, okay, some dairy, and so on. What's important to know is this, okay? And that is there are 3 main reasons why we need energy as human beings. We need it for our brain, we need it for our viscera or our organs, and we need energy to oppose gravity. When it comes to the order with which the body uses energy, it's the brain first, gets the most, your heart number 2, and then your liver, okay? As we take food and we digest it in a healthy way, we should be maximizing the amount of energy from our carbohydrates. The main reason for carbohydrates is energy, period, okay? Now, when we're not effectively digesting carbs, some of the things that you might notice when you're not breaking them down is you might be really dry. You might be dehydrated. You might have the inability to concentrate. You may have a lot of muscle cramping. You might have a lot of low energy, fatigue. Okay? These are just some of the things when you're carb deficient, when you're not utilizing carbs from your diet properly. In other words, when you're not digesting carbs well and or eating enough carbs. So when I say deficient, it means 2 possibilities. Not digesting and or not eating enough. Okay? Don't just think deficient because you're not eating enough. That's not the main reason. So that's going to lead to dry, itchy skin, dry eyes, dehydrated, can't concentrate, muscle cramps, low energy, fatigue. Okay? This is the number 1 reason we get our energy, through carbohydrates. But when the body can't effectively use the energy from your carbs because you're not digesting it or you're not eating enough, now your body is going to start tapping into your proteins for use, something called gluconeogenesis, okay? So your body's going to start breaking down your proteins for sugars. That's not how the body wants it to go. And as I said, carbs, their main role is to supply energy. Well, proteins, they do a lot of other things, okay? So their number 1 task is not to supply energy at all. It is to give us, from the food we're eating with protein, to give us insulin, thyroxine, hemoglobin. This all comes from your proteins, guys. Your neurotransmitters. Okay? Epinephrine. These are the things that we get from protein. So you can imagine then, if you're not properly digesting your carbs, you're not going to get enough energy. Now the body's got to start utilizing proteins for use. It'd rather not do that. And if it has to use proteins for use for energy, what do you think is going to happen with the creation of these very important chemicals here? They're going to start to be disrupted. So we now have entered into this cycle, this cascade of doom, if you will, because we should not be using proteins for energy. We should be using carbohydrates for energy, not proteins. Now, if you're having some signs of protein deficiency, meaning symptom-wise, so we talked about symptoms attached to carbs, being, dry, dehydrated, and so on. When you can't digest proteins, you might notice that you're wet, okay, an increase in secretions. So you have watery eyes, watery nose, okay? You're going to have cold hands and feet. Menstrual cramps. Bleeding gums. These are just some of the symptoms that one might have when they're protein deficient. Again, meaning not digesting protein well primarily, and also not eating enough. Okay, protein deficient. And finally, how we use energy, we would rather not, but now we're starting to dip into fats. And this is not what the body prefers. And I'm not talking about a ketogenic diet, by the way. Okay, that's a whole different animal. I'm talking about just somebody eating normally as they think is a normal way to eat. We should be getting our energy from our sugars or our carbs first, then proteins if necessary, and then very last the body's going to tap into the fats for energy. And this is not good, okay? Because your fats have other roles that are more important than giving us energy. And these are going to be things like prostaglandins. Fats in our diet supply us with prostaglandins, which have a lot of inflammation effect. It has everything to do with getting pregnant, keeping the baby, holding the baby to term. Prostaglandins has a lot to do with that. Fatty acids are derived from fats. Phospholipids. These are your cell membranes. Okay? We've got our cholesterols. We've got our sterols. We've got our sex hormones. These are all derived from fats in your diet. Okay, so that's their primary role, is to give you these things. Prostaglandins, fatty acids like omega-3s, omega-6s, and so on. Your phospholipids, which are your cell membranes. Cholesterol, sterol, sex hormones. These are supposed to be the primary thing that fats give us from our diets, not energy. So imagine now if you cannot properly digest these 3 macronutrients, your fats, your carbs, your proteins. Imagine now that you're not properly digesting these nutrients. Now you're going to have energy deficiencies. Energy is everything. Okay, we talked about the brain, the viscera, keeping us upright against gravity, right? So if you're not supplying yourself properly with the food you're eating, that's a problem. And also, more commonly, is if you're not properly digesting what it is you are eating, this is going to create energy deficiencies. This is going to create distortions in human health. And so when you have stiff, achy joints, when you have heartburn, when you have diarrhea, when you have constipation, I don't want you just thinking about those symptoms. I want you first to be thinking, you know what? I have energy deficiency. Somewhere my body is not utilizing the fats, the carbs, the proteins the right way. And let me just tell you this as well. Vitamins and minerals do nothing to supply you with energy. Let me say that again. Vitamins and minerals do nothing to supply you with energy. Fats, carbs, and proteins do, specifically carbs, okay? Vitamins and minerals are effective in the presence of enzymes to do what they need to do. So when it comes to fats, some symptoms that you might experience when you have a fat deficiency, again, these are the symptoms associated with deficiencies. And these are going to be things like also dry skin, tremors, pregnancy, okay, women have an issue with pregnancy, keeping a baby to term, also inability to concentrate, okay, this means concentrate, and those are the main ones for that, for fats. So when you can't digest fats, it's actually common to have a miscarriage. And I will tell you, since my being in practice, which has spanned more than 17 years that I've been in practice, it's very common that I'll see women who come here who have had a history of miscarriages. And, you know, this is a very common thing. And the body is so smart, it will not allow that pregnancy to continue if it knows it can't support the pregnancy. The human body's innate intelligence knows this. It knows, the human body, if it can't support that baby to term. And if you think about it, it's a smart thing that the body does that. It's going to remove something that it knows it can't support. And it's just really important that people start to look at the food that we are eating and its direct correlation to energy that we do or do not have. Abraham Lincoln said, "Be sure your feet are in the right place and then stand firm." Be sure your feet are in the right place and then stand firm. My job is to find out where are all these energy deficiencies in a very specific way that is unlike typical medicine. Unlike it, okay? I check a very specific way in person, if you are here local or if you fly over to come see me. And what I'm looking for are deviations from normal. I'm looking for deviations from homeostasis. And a primary way that I'm doing that is with a very specific urinalysis. And if you're local, I do the urinalysis and a very specific physical exam. And what I'm looking for with my physical exam are involuntary muscle contractions. Involuntary muscle contractions. I'm not doing applied kinesiology. If those of you watching are AK practitioners or see a practitioner that does AK, not judging it, I'm just saying to you, that's flat out not what I do. I am having you lay on my table while you fasted for 8 hours, and I'm checking for involuntary muscle contractions over 20 different digestive test points that relate to your viscera or your organs. Why a muscle contraction is so important is that a muscle contraction is a clear indication of energy deficiencies. Muscle contractions are clear indications of energy deficiencies, whether it's coming from fat, carb, or protein. That is what has turned my practice around when I started doing this work, when I started employing this work 10 years ago, and I've never needed to look back. And if you guys want to follow along, there are 3 ways that you could work with me by going to virtualdigestiondoc.com. Virtual, because I work with anyone in the world, digestiondoc.com. These are the points that I'm checking for on my page, okay? And I'm checking these points 2 times. 2 times. When they first are laying down, I'm checking these 20 points, takes about 5 minutes. I'm writing down the ones that are positive, okay, where I feel that muscle contraction or I see that shift in their posture. Then I need to challenge how their body handles food. And so what I give is a tea. And that tea, just a mugful, it's nothing gigantic, I promise. In that tea is a ground tablespoon of pumpkin, flax, fennel, and fig powder. These are equal amounts of your 3 macronutrients that I described on the board. Your carbs, your proteins, your fats. So that tea is equal amount of those 3 nutrients. We have my patient drink that drink, then they rest for 45 minutes to give the body enough time to digest that meal. After 45 minutes, back on my table they go. Now I'm checking those subsequent 20 plus points a second time around, looking to see which points significantly worsen, all right? Whatever worsens is a trouble spot for that particular person. And that, my friends, is again why the medical model is so broken, is that they treat everybody the same. It's a one-size-fits-all approach. This is the medical model. This is why it's broken. This is why I'm here doing these videos. It's not about prescription meds. They will never restore function. How you're going to restore function is giving the body what it needs, which is food, fats, carbs, and proteins, vitamins and minerals, okay? And obviously enzymes are the special proteins that make all that stuff that I said above, fat, carb, protein, vitamin, mineral, work. Enzymes are the only things that are going to get undigested food past an incompetent digestive system, period. The second thing that I'm checking for is a very specific urine test. Okay, a very specific 24-hour urine test. I don't need to test blood or stool because it doesn't give me what I need. So this is what I call my 14-point discovery system. So this is through my physical exam that I talked to you about. You can find all of this by going to Virtual Digestion Doc. I'm checking fat, protein, and carbohydrate digestion. I'm checking for something called indican, which is a measurement of bowel toxicity. I'm checking for stress, digestive stress on the thyroid, the pancreas, spleen, liver, kidney, adrenal. We're measuring your pH, which is your acid-alkaline count. We're looking to see if there's a presence of yeast, specifically looking at calcium and other electrolytes. Looking at right and left side of your colon for stress, ascending and descending. Measuring your vitamin C, because vitamin C is very linked into how strong or robust your immune system is. I'm looking for cell energy, which is the presence of leaky gut. And we're looking for tissue breakdown. Okay, so these are 14 of the things I'm looking for. These are the main ones. But I'm also checking for things like, is there glucose in the urine? Is there protein in the urine? Are there elevated white blood cells in the urine? So I'm checking more than these 14 points. Again, you can go to virtualdigestiondoc.com to check that out. If you liked anything that you saw here and you want to work with me, virtualdigestiondoc.com. If someone wants to throw that in, I love you. virtualdigestiondoc.com. That's my site, how you can connect with me. I stand firm that what I am saying to you is the truth. There is certainty behind it. The body knows how to heal itself, and the body will heal itself with the real medicine, which is food. However, just because you're eating that food, you need to properly break it down and digest it, and that's where I come in.